Hi, I'm Lorna. I'm one of the speech and language therapists at Queen's Square, and I specialise in functional neurological disorder. This video is about swallowing difficulties that can occur with FND. If you are experiencing changes to your swallowing mechanism due to FND, then you may have chosen to make changes to how or what you eat and drink. Your speech therapist will want to discuss the symptoms you're experiencing and how best to approach retraining your body to experience the swallow in a more comfortable way. In the meantime, it would be helpful to keep a brief journal of symptoms. You can try phrasing your journal like this: when I'm feeling tired, my swallowing is, or swallowing is easier when I feel, or when I do. You can also take note of the following things. If and when the symptoms are better or worse, for example, when eating foods you like or certain food consistencies, such as very smooth foods, and when you're eating with people you feel comfortable with or at different times of day, what do those symptoms look like? Describe your symptoms to help you tune into them. For example, it is more challenging to eat and drink when. A typical day of eating and drinking is useful to capture. For example, what does typical breakfast, lunch, dinner and snacks look like for you? Some general tips on managing your symptoms. Like other physical symptoms, speech or swallowing can be impacted on or triggered by heightened emotion, such as anxiety or stress, or even feeling tired. Some general strategies to manage these might be: rest when your symptoms are very hard to control. This will help your brain to not use the pathways or roads that drive your symptoms. Engage in mindfulness and relaxation exercises if these are useful for you. These can help manage feelings and emotions which are linked to speech and swallowing changes in FND. Being in a more relaxed and a calmer place can allow opportunities to produce speech and swallowing patterns that you're aiming for. When symptoms are difficult, you can also try grounding practices. Sit comfortably, scan your environment from left to right, pick a colour and see how many objects in that particular colour you can see, or alternate tapping your feet on the ground while sitting, similar to marching on the spot. Visualization tasks may also be helpful for some people. For example, imagining yourself saying things in the voice you want, or swallowing food and drink safely and clearly with no obstructions.